topic that I will be discussing today is on multiple sclerosis or MS. Multiple sclerosis is a progressive demyelinating neurodegenerative autoimmune disease of the central nervous system, which includes the brain and the spinal cord. Usually this disease presents in the early adult life, particularly between the ages of 20 to 50, most commonly in women. Now, there is no completely defined causes of multiple sclerosis. However, since it is an autoimmune disease, it is believed to involve both environmental and genetic factors. Now, when we look at the environmental factors that are involved, it always comes down to a susceptible gene. There is no completely defined causes for multiple sclerosis. However, since it is an autoimmune disease, it is believed to involve both environmental and genetic factors. When we speak of environmental factors, it comes down to viral infections. For example, the Ebola virus, the herpes, human herpes virus type 6. The relevance or the connection between viral infections and multiple sclerosis will be explained in the following slides. The second environmental factor is vitamin D deficiency, and studies have revealed that people residing in the equatorial regions have higher levels of vitamin D, hence are less susceptible to the disease. The next factor is the genetic factor, and when we speak about the genetic factor, it comes down to a susceptible gene, and in this case it is known as the HLA-DR2 gene. The HLA-DR2 gene is a gene that is involved in the synthesis of certain molecules which are involved in immune defense mechanisms, and a mutation in these genes causes an exaggerated immune response when a person is exposed to viral infections, for example the Ebola virus or the human herpes virus. The second genetic factor is that it is commonly found in people with XX chromosomes, that is females. Now, the incidences of multiple sclerosis, studies have found that people suffering from multiple sclerosis always have a family member also suffering from the disease. However, having said that, studies on identical twins, and identical twins are individuals who have the same DNA. So it has been found that even in identical twins, there is 1 in 3 chances of both the twins inheriting the disease. So therefore, it can be said that multiple sclerosis does not depend entirely on genes. The disease multiple sclerosis is characterized by demyelination or loss of the myelin sheath. Now, as you can see in the image, the myelin sheath is a fatty acid sheath that surrounds the axons of neurons or nerve cells. And these nerve cells transmit signals from one nerve cell to another, or from one nerve cell to a gland, or from a nerve cell to a muscle through these axons. So in a healthy individual where the myelin sheath is intact, these signals are transmitted smoothly. Whereas in the patient suffering from multiple sclerosis, there is a destruction of the myelin sheath which causes disruption of the signals. This next diagram is a very simple representation, but it speaks a lot. If we look at a normal individual, a healthy individual, the myelin sheath is intact. And in such individuals, when they are exposed to viruses, the immune cells, for example the T cells, act upon these antigens or upon these pathogens and neutralize them. However, in case of patients suffering from multiple sclerosis, the T cells, instead of acting upon pathogens, for example when they are exposed to certain viral infections, these T cells migrate into the brain area or the central nervous system, and they, instead of acting on the antigens, they in fact recognizes the myelin as something foreign and attack the myelin, thereby causing destruction of the myelin sheath. So as a result, the signals, there will be a signal disruption between the nerve cells and other cells. So coming to the diagnosis of multiple sclerosis, so during this destruction of the myelin sheath or the cells that make up the myelin, which is the oligodendrocytes, this results in signals that are stopped or even slowed down. Now this disruption of the myelin sheath appears as sclera or scar or even plaques in the brain and the spinal cord, hence the name multiple sclerosis. So normally in addition to the other diagnosis, the most important diagnosis for multiple sclerosis is only the CT and the MRI scans. So as we can see in the slide, this shows the brain, MRI scans of the brain and the spinal cord, where there are certain scars on the brain and the spinal cord. So this is a typical scan of persons suffering from multiple sclerosis. Now coming to the symptoms of multiple sclerosis varies from person to person, is complex and unpredictable. This is because this would depend on what part of the brain that has been demyelinated. So however, in general, there are 4 types of multiple sclerosis. The first one is relapsing remitting multiple sclerosis. Symptoms in this type come in the form of attacks. In between attacks, people recover or return to their usual level of disability. When symptoms occur in this form of MS, it is called an attack, a relapse or exacerbation. The periods of disease inactivity between MS attacks are referred to as remission. Weeks, months or even years may pass before another attack occurs, followed again by a period of inactivity. Most people with MS are initially diagnosed in this form of the disease. The second type is called as secondary progressive MS. Secondary progressive MS, in this type of MS, the people usually have had a previous history of MS attacks, but then start to develop gradual and steady symptoms and deterioration in their function over time. Most individuals with severe relapsing remitting MS may go on to develop progressive MS if they are untreated. The third type is called primary progressive MS, and this type of MS is less common and is characterized by progressively worsening symptoms from the beginning with no noticeable relapses or exacerbations of the disease. And finally, the fourth type is known as progressive relapsing MS. This is the rarest form of MS, which is characterized by a steady worsening of symptoms from the beginning with acute relapses that can occur over time during the course of the disease. Now, in spite of any of those 4 types of MS, patients suffering from multiple sclerosis have or suffer from these common signs and symptoms, which include emotion and cognitive. Patients may suffer from fatigue or tiredness. They may become depressed. They may have speech issues and hence also inability to swallow. They may have mood swings. They may also have trouble thinking. That is, their planning and the ability to make decisions will also be affected. The second type of symptom are sensation issues, whereby the patients experience tremors in certain parts of their bodies. They also suffer from painful muscular spasms. They also experience numbness and tingling, and they also lack coordination. The other symptoms are visual disturbances, for example, blurred vision at the onset of the disease, which may deteriorate further, with some patients losing sight in one eye or suffering double vision. The patients may also experience nystagmus, that is, involuntary movement of the eyes. The other symptoms that are associated with MS are problems with bladder control and constipation, where the patients do not have any control over their urine. There is no cure for MS, but there are treatments that can reduce the number and severity of relapses and delay the long-term disability progression of the disease. The medical treatments has been divided into several categories, some of which are mentioned below. The first one, use of medications treating some aspects of the inflammatory process. The second type are medications that help decrease the severity and duration of MS relapses. The third are medications that help ease MS-related symptoms such as fatigue, spasticity, and pain, to name a few. And the fourth treatment is physiotherapy. Physiotherapy is believed to prevent unnecessary disability and handicap. It also helps in improving the individual's quality of life. It also preserves musculoskeletal integrity and manage fatigue. However, because of the range of the symptoms and severity of some symptoms, patients are advised to avoid the following S. The four types of S's. The first one, stress, that is exercise, surgery and injury. The second S, sickness or sepsis. The third type, smoking. And the fourth type, sun exposure and extreme heat. Although researchers have not been able to identify the cause of MS with any certainty, there has been excellent progress in other areas of MS research, especially in the development of new treatments to prevent exacerbations of the disease. New discoveries are also constantly changing MS treatment options and helping to reduce MS-related disability. Development of better monitoring tools such as more powerful MRI methods to diagnose MS, track disease progression and assess treatments. With this, thank you very much.